staying with our lead story this morning, which is the announcement of the further easing of lockdown restrictions, indoor and outdoor venues are now able to accommodate up to 50% of their capacity, pending, of course, proof of vaccination or a negative COVID-19 test being presented. The maximum number of people allowed to attend a funeral has been increased from 100 to 200. And making the announcement last night, President Cyril Ramaphosa said that the easing of these restrictions comes as scientists say that the country has achieved immunity levels against the deadly COVID-19 virus. So for more on this, we're joined by the Director General at the National Department of Health, Dr Sandile Buthelezi. Dr Buthelezi, thanks for your time. Welcome to Morning Live.
Yes, good morning, Sakina, and good morning to the viewers.
Dr Buthelezi, from a Department of Health perspective, given that the scientists have said that we have now achieved immunity, what has informed these latest changes to the regulations?
Yes, no, thank you very much, Sakina. As we are aware, as a country, we are trying as much as possible to ensure that we go back to normal as soon as possible. However, this virus is not predictable. We're not sure of what's going to happen. The scientists themselves have told us that we might be getting another wave not long from now. So hence, we are taking a progressive way towards the releasing of the restrictions that are there as a country. So we, with our MEC, of course, sometimes we do differ there and there. But they do give us guidance now and again, and we do have to take that guidance to other stakeholders. They come in as the scientists, but we do, as the President mentioned, there are then other structures. We go through the Coronavirus Council. There were meetings with the religious sector, with the traditional leadership, just to also at a network level, just to deal with the issues, and then the final decision is made on how we move. Of course, we don't have to be reckless when we move towards this. But what has informed this now is that, as the President has announced, we will be probably be getting out of the state of disaster not long from now. Hence, we have drafted the regulations in terms of the Health Act to take over the management of any epidemic. I must be very specific. The regulations are not specific to COVID. In future, we might have Ebola or any hemorrhagic fever that comes in. We should be able to deal with those epidemics when they come.
So just speaking about consultation, Dr Buthelezi, and I'm reminded in the news where we saw reaction from political parties as an example, you had Dennis Bloem from COPE saying that there's no longer consultation with regard to these announcements. Then also a few weeks ago, that was last week when the announcement was made of the extension of the state of disaster, the Western Cape Premier Alan Winde also made mention of the fact that there doesn't seem to be consultation with key stakeholders as per the provisions. So speak to us about how and when these consultations are done, and how these other stakeholders are actually brought into the consultation process before making decisions.
Yes, though I'm not a competent authority to comment on political matters. However, on a government level, I can say that yesterday morning there was, before the President spoke, there was a meeting of the Presidential Coordinating Council where the President consulted with the premiers, the mayors of the metros, the leadership of SALGA, the MECs of COCTA, just to ensure that what was announced last night was consulted upon. And I must also confirm that we were part of the meetings with the religious sector. We were part of the meeting with the traditional leadership. So there are consultations, of course, led from the center of government, which is the presidency at that level. At a political level, I'm not a competent authority to comment on.
So I will then defer that question perhaps to someone else for the time being. But with regard to the levels of vaccination, let's talk about that. And given what still seems to be a bit of hesitancy on the part of many South Africans to get vaccinated. Let's talk about that, Dr. Buthelezi. How many South Africans are vaccinated, and do you believe that at this stage more South Africans will still come forward in their numbers to receive the vaccines?
Yes, we are actually urging the South Africans to come forward, and we believe that having introduced this easing, that is the easing of the restrictions that is actually related to vaccination. For example, let's talk about a soccer stadium. If you look at FNB Stadium, I'm not sure if its capacity is 80,000, so they can fill up to 40,000. However, the people have to either produce a negative test or have to be vaccinated. We believe that that is going to actually incentivize the people to vaccinate, specifically the younger age groups. As the President mentioned last night, the older people are more than 60. We have more than 60% vaccinated already. However, our problem are the 18 to 34-year-old who are really very hesitant to vaccinate. And we believe that having to introduce this vaccination-linked opening up, we're going to get a lot of people coming up to vaccinate. But it's very important for the people to know that the vaccination is going to protect them and also protect their families as we move forward. So we believe that we are still going to get a lot of people coming up for vaccination.
So is that, for lack of a better phrase, Dr. Buthelezi, is that a ploy to kind of almost force people to vaccinate? Because if people haven't vaccinated up until now, they've had ample opportunity, there have been ample calls, ample activations, and people still haven't vaccinated. So is this a way to perhaps coerce them a little more forcefully to get vaccinated because they want to attend a sporting event, as an example? Because I don't understand why that would be a condition, given that if it's an outdoor facility especially, if you're saying we can walk without masks outdoors, if there is a sufficient immunity as per the scientists that we have achieved either by design or default as a nation, then why should the people have to produce a vaccination certificate to attend a sporting event?
Yes. Firstly, a sporting event is a leisure event. So it's not like you are forcing someone to go and watch soccer. But I must say that we've done a lot of work. We've worked very closely with the World Health Organization office, and we've done benchmarking internationally. It's one of the issues that we've taken into consideration. This is not forced vaccination as far as we are concerned, but it's really trying to incentivize the people to vaccinate if they want to enjoy what they like in life. But more so, it's for their own benefit in terms of health. It's not like it's for the benefit of us as government. Of course, we do have an interest in getting more people healthy, living longer, not being admitted into hospitals.
So just how is this going to play out, Dr. Buthelezi, in terms of people accessing those certificates for those who have already vaccinated? Let's just talk about that. How do they get access to those certificates once again? Because now they are going to be expected to produce that as proof at gatherings.
Yes, thank you very much. Actually, you do get an SMS when you've been vaccinated that gives you a link on how to download the certificate. But also, we still have our call center. We just met with the people that are assisting us with the call center, that people can still call the call centers and find the mechanism of how to actually get hold of these certificates. But also, in addition to that, we are going to be working with the organizers. Remember, for example, I made an example of soccer matches. The onus will be on the organizers. If it's the PSL, we will be working with them to ensure how do they actually verify those certificates. If someone comes in, and how do they actually ensure that they are vaccinated. So our team has actually put together a system that will be used to ensure that people access the certificates and they are able to be verified if they are actually authentic or not.
So how long do you anticipate that would take? Because as the President announced, all the announcements from last night would be effective today. So if I were to go to a football match today, surely those measures should be in place already.
Yes, the team has put the system in place. The system is in place already. We're actually meeting now at 9 o'clock, and we will actually be releasing information to say if you're arranging an event. We'll be releasing a statement to say how do you actually go about in terms of verifying the certificate. But also there is, if you go to the COVID site, there are numbers where people can phone the call center, where we've got people that are able to explain to the people what to do and how to get it. But we'll also be releasing a statement again after 9 o'clock this morning.
And we also will be opening our lines here on Morning Live, Dr. Buthelezi, if you're able to, perhaps worth listening to some of the issues that people may raise on that, or if someone from your team would, because I think important that we get reaction from the broader public as well to these announcements. So looking at the question of unvaccinated people entering South Africa that will be offered a vaccine, can you please explain that to us a little further, please, the process of that?
Yeah, what will happen is that if people come into the country and the people there are unvaccinated, obviously they will need to produce a negative test to enter the country. But if you are vaccinated, you don't have to. No test is required, so you will be able to be admitted. If you are unvaccinated and you've produced a test, and then you know that in the ports of entry we have the clinics available, and then we'll then be offering people, look, we are not going to be forcing people. We'll say if you want to vaccinate so that in future you don't have to really have the inconvenience of getting a test, there is a clinic, you can go and vaccinate, and we'll be able then to record that. And there is a system in place in those ports of entry that we have through our port health services and our national health laboratory services.
And speaking to that, the vaccines that South Africa has procured as a country, how are we faring with, getting those shots into arms at this point, Dr. Buthelezi? And there was discussion about some of these vaccines reaching their expiry date. How many of those doses are in that category at this point?
Yeah, we've got quite a number of doses that are at a risk of expiry by the end of this month, but we think it's going to we're going to have more pressure as we move towards June. And I must say it's the Pfizer vaccine that we're having a problem with in terms of the shelf period. The J&J, we are still good as they will start expiring next year. So what we are currently doing is that we are working with the international bodies like COVAX to try and exchange some of those vaccines for the countries that are needing them, so that we might recall them when we need them sometime in the future. So there are numbers, I don't know because I've not confirmed the numbers now, but as at yesterday, we were looking at around close to 80,000 that might be going towards expiry towards the end of this month. However, we are pushing in terms of pushing for more vaccinations and trying to ensure that they get into the arms. There are other arrangements that we are doing with the neighboring countries that will be announced in the due course to ensure that those vaccines, they do get used by those that are in need, and then finding a mechanism of replacement.
And then, Dr. Buthelezi, you said you're unable to give us an exact number because, issues like costs also then become, a factor. And that's for those that are expiring by the end of this month. What about the following month? Let's take a short-term, prognosis of this particular matter regarding vaccines expiring. In the next, say, quarter year, how many doses of that vaccine are at risk of, expiring here in South Africa?
Yes, I mentioned that we're looking at around the 80,000, but we can find the figures and I'll get the team and then we can send them to the producer just to look at how many exactly so that we don't speculate in terms of the numbers.
And then, Dr. Buthelezi, also just a question coming through about people who may have forgotten the reference they were given when they got vaccinated. I know you said earlier that you would have received an SMS, but does the system make provision for that? Someone who is just unable to access their information, can they give an ID number as an example and retrieve that information?
Yes, the ID number, yes, they can use the ID number. That is why at the point of vaccination, we always use some form of identification. Even the passport numbers are actually used as a form of identification when people get into the system.
Dr. Buthelezi, also with regard to the issue of PCR tests. Now, there's been a lot of talk around this in terms of the cost of that, number one, but also people will obviously be expected to use this option if they are unvaccinated. So just in terms of, say, if we take the soccer stadium example, if people who are unvaccinated now need to test upon entry, do we have the necessary facilities around the country to actually deal with that?
Yes, we've made an arrangement already. There's quite a number of clinical operators that we are working with that we funded through the Solidarity Fund. And we are making arrangements that on the sites, we actually do arrange for testing facilities when people get in, but also that will be, of course, then the antigen test that will be used. But also, in addition to that, we are going to be putting in the vaccination sites even around the stadia so that we actually take advantage of those situations to get people vaccinated.
So regarding the issues of mask wearing, Dr. Buthelezi, so it says that masks must be worn in indoor spaces. They don't have to be worn outdoors. Just in terms of the policing of this again, are we just putting it there, or is there any real sort of impetus behind this to make sure that people actually adhere to the regulation?
Yes, there are. If you look at the regulations that we have published, there are actually consequences. Specifically, the onus is on the organizers and also on the compliance officers, because also the regulations, they do talk of compliance officers for example, in the malls or in the shops where people need to ensure that people adhere to this. But more importantly, Sakina, we are putting the responsibility on individuals and on South Africans to be responsible. We don't really always have to police because this is to the benefit of all of us. It's not like it's to the benefit of a particular government official. So that's a responsibility we're putting. However, then there is consequence management, and the regulations are very clear that if people do not adhere to what is in the regulations, as the regulations are actually a subordinate legislation to the actual law, which is the Act of Parliament, people may actually be jailed or be fined. That is there in the regulations.
And just with regard to the end of the state of disaster, many people, of course, expecting that to have ended at the last announcement, but of course it was extended for another month. Are you confident at this point, as the Department of Health, as one of the key departments and leaders in this particular sector, that it will be lifted at the next extension date?
Yes, from where we sit, though that's not our competence, it's a competence we do provide information. It's a competence of government, but from our side, we believe that having gazetted the regulations for public comments, of which we are actually requesting the South Africans to comment on those regulations, we believe that we'll be ready to take over when the President, the Cabinet, consulting the PCC, we will be able to take over when the period of comment has come to an end and we've taken into consideration what the public is saying about the regulations.
And just a final one, Dr. Buthelezi, a question about the department's handling of applications for exemption letters for those who tested positive. Can you just explain that to us, please?
Yes, we do deal with a lot of those exemptions that come in. We are actually trying to make it easy for the people to be able to deal with those, which we deal with through portal services. And we handle them as they come in. We've actually now delegated that to our regional people who are in charge of portal services in different provinces to deal with that, and we're able to respond timely. We will probably find a better way. We've asked our Ministerial Advisory Committee to actually just guide us on how we make it easier for the people to get these exemptions. But for now, they still have to apply, and we grant them those exemptions as a department.
Dr. Sandile Buthelezi, thanks for your time. Director General in the National Department of Health, talking to us after last night's announcement by President Cyril Ramaphosa of further lockdown restrictions.